It's the cold hard truth. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there is a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way that things will really go with Sandra. And some will start to criticize, get on the show and tell pure lies, but someday we'll realize it's Sandra. And when they start to argue again, she'll pull the heads to the wind, and soon you will be a friend with Sandra. 'Cause every day everyone wants to hear from Sandra. 'Cause every day everyone wants to hear from Sandra. 'Cause every day everyone got to hear from Sandra. 'Cause every day everyone got to hear from Sandra.
All right. Good morning. How is everybody doing this beautiful Tuesday morning? Yes, it is showtime again. This is showtime vacation mode. Yep, we're still on holiday. Let me go ahead and turn on my camera. I know you guys want to see me. Hello, everybody. How are people doing? Uh-oh, hold on. I notice I can't hear myself. Let me just play with my little headset here and see what's going on. All right, can everybody hear me okay? I can't really hear myself, which is not good. I do find this front port is a little bit funny. Can anybody hear me? Oh, there we go. Ooh, needed to turn up the sliders. Right, good morning. Can everybody hear me now? No wonder I couldn't hear myself. All right, I think we're good. Yes, it's important to be able to hear yourself talking, because then that way you can make sure that everybody else can hear you and things are working properly. This front port is a little bit sus, as those young people would say. Oh, these kids are so funny. I love it when Gigi says, "Mom, somebody's looking at me kind of sus," and I have to try to understand, what does that mean? What does having someone look at you sus looks like? What does it mean? Tell me more details. All right, so I'm going to refresh your links. Let me do that. Just a reminder that we are keeping consistent links these days, just to try to help everybody out in terms of, you just do the same link every day, makes your life easy, makes our life a little bit easier. So hopefully that helps. And we have, today is Tuesday, so we do have medical rundown Tuesdays. And this is a really, really interesting conversation that we're going to be having this morning. So let's go ahead and welcome Shamari Scott into the studio with us. He's no stranger here on the program. Good morning, Shamari. How are you?
Good morning, Sandy. How are you?
I'm doing fantastic. Some nice crisp
Okay.
breeze. I had to put on a sweater this morning. It's kind
I
of
was
chill.
about to say, wherever you are, you look cold.
It's crisp. It's not cold, but it's definitely, that
Hey,
morning
wake you
crisp.
up. Wake you up. You don't need
Yes.
coffee. But I don't know if you drink coffee or not, but
That's yeah, I don't, but yeah, this will definitely do it. So I had to throw on a little sweater this morning. Yesterday I was like, blanket time. But
that's
it's
good.
all
That's
good.
good.
I'm really enjoying it. I'm enjoying the remote setup because, Shamari, this
Hmm.
reminds me, because, in the near future, CMR radio is going to happen this year. And so this reminds me of the possibilities. Oh, sorry. Gonna mute YouTube there. This reminds me of the possibilities that we have of even doing remote shows and on remote location. So I always find remote shows to be fun. I haven't done a whole lot of them, but it's fun to do. So this reminds me it can be done
All right.
relatively simply.
So you have no excuse on the chamber travel.
That's
Um,
what.
if
Oh
you're
no,
if you're going this year, you have no excuse,
no,
to
that's
be off.
proper vacation. So Marlon refuses to let me do anything on those related to work.
Good, 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 good for Marlon. Good for Marlon.
Yeah. So how was your week?
Yeah, week was good. We've no football, so
Yeah.
now we're in morning, no football Sundays, but that's okay. We'll fill it in with the NBA,
Mhm.
and in June, July we'll have the NBA finals. So we'll fill the void. But everything was good. Weekend was good,
Yeah.
restful.
Awesome.
I can't say restful because you have kids and they have so many different activities that you have
Yeah.
to they have to be a part of, and you have to carry them
And
here and
you've got
there. And
3 boys, so I can imagine that they keep
oh,
you
yeah,
very busy.
correct, correct.
Yeah.
So,
Yeah.
but it's all good, all good.
All right. Well, I
Feeling
got to
amazing.
vicariously live through your social media page in terms of the footage and the videos from the Super Bowl party. It's getting better every year. I mean, this is like a
Yeah,
level party now.
yeah. It's been pretty good for a few years. It's grown as my friend group has always been large due to sports. So from
Hmm.
college, we've been having our version of a football party, in the dorm, and then when one of our friends had an apartment, then we would have it there, and then as I mentioned before, when I came home, can't have that at my parents' house. So we would go elsewhere. And then eventually, when I had my own abode, then started having it there. And now that I have a backyard, I can invite a few more people. So yeah, it was
Absolutely.
it was really, really good. Everybody enjoyed it. And the
Fantastic.
Patriots lost, so I
Yeah.
enjoyed it as well.
Wonderful. So, listen, I think most people know exactly who you are there at Health City.
Yes,
And today we have a really, really important conversation.
definitely, definitely.
It's so interesting, but when I was printing off my notes, I showed the topic to our cousin. He's like, "Oh, that's what my dad has." And this is something that is very, very common. So, we're going to have Dr. Ravi jump in here on the conversation. But I don't feel like Dr. Ravi needs any introduction, but just in case someone may have missed who he is, let's go ahead and take this opportunity to reintroduce him as well.
Yes. So Dr. Ravi, everybody knows and loves Dr. Ravi, and he's part of the A team that was with us when from inception, that Dr. Shetty trusted as one of his most senior cardiologists and electrophysiologists to be able
Hmm.
to come to the Cayman Islands and help us to really take off. And he's done an amazing job since he's been here.
Hmm.
Anytime you mention Dr. Ravi's name, there are rabid fans that come out to talk about how great he is. But he is responsible for a multitude of health-related clinics, such as the heart failure and atrial fibrillation clinics. He's an expert in clinical arrhythmia research, resistant hypertension, cardiac MRI, CAD or CAD prevention, and the list goes on. He's had over 20 years of specialist, well over 20 years of specialist experience. And as you said, he is no stranger to people in the Cayman Islands, but just in case, because we have a transient population as well,
Hmm.
just in case people don't know, just wanted to make sure we introduce Dr. Ravi Kishore. Um, with a warm welcome back to CMR as well as to the listening public.
Yes, absolutely. So let me just pull him here. Good morning, Dr. Ravi. How are you?
Hi, good morning. Yeah.
I just sent you a little message in the private chat. I'm not sure if you can see it. Yes, just a little adjustment I want you to make so we can see you a little bit better.
Oh, yeah. Are
Yes.
you able to hear me and see me?
Yeah, I can hear and see you, but I do want you to pull down your if you're on a laptop, just pull down that camera, the lid a little bit for me. Pull it down so we can see more of you.
No. Yeah.
Oh, okay.
Okay.
Right.
Is that better?
Yes, that is better. Thank you so much. So good morning to everyone who is joining us in the chat this morning. Thank you guys so much. So Dr. Ravi, how have you been? I'm thinking this might be the first time I've seen you in the New Year. So hopefully you had a wonderful Christmas and Happy New Year.
Yeah. Thank you. Thank you. It's been great. Yeah.
Yeah, so we're here to talk about a pretty significant topic this morning because it seems like a lot of people at some point in their life might have to deal with this. We call it AFib for short, but tell us what atrial fibrillation actually is. Atrial fibrillation.
So it's the most common rhythm problem of the heart. So you have people complaining of palpitations, and if you have an elderly person complaining of palpitations, it's most likely to be atrial fibrillation. So atria is a structure, the cavities on the top of the heart, the cavities on the bottom of the heart or the ventricles. So fundamentally, it's part of the pump of the heart. So the atria has a muscle, and when this muscle has some kind of a minor disease, it can start having electrical short circuits within that the normal electrical system. And these short circuits will lead to a very irregular beating of the heart, which will translate into a very rapid pulse, which is felt by the patient and as palpitations. So this is atrial fibrillation. Fibrillation is a very random beating. It's a term which means that there's a random activity. So when there's a random activity of the top of the heart, you call it as atrial fibrillation.
Interesting. Okay. And how many people would you say it's the most common? So, in a person's lifetime, like, is it 1 out of 10 people? Is it, what sort of numbers are we looking at and how common it is?
Rather than looking at the numbers, because these numbers, whatever are derived are from selected populations from certain countries. So simply speaking, it's a disease of aging. The risk increases as you grow older. The highest risk is in people beyond 75 years, that a significant portion of them, number of them can have atrial fibrillation, which is sometimes not felt. You only pick it up on monitoring, and many of them get failure. So it's a disease of aging of the heart muscle. Plus, the most important problem with atrial fibrillation is it can lead to devastating complications, which we will discuss. So that's why it's so important. And as the population is aging and the longevity is increasing globally, so this is possibly becoming one of the most important non-communicable diseases which we have to deal with, and the public health system too.
Oh, wow. So let's just go through exactly what this is. So you say it's so incredibly common, and why should we care about this? Like, how does AFib impact a person's life?
So I don't know. Yeah, I can just show you the heart muscle here. This is the heart. I've broken the heart. So this is the top. These are the atria. So when the atria fibrillate, what happens is it's not actually contracting. It is just a random movement of the heart muscle that's happening. So there is going to be a blood stasis in that chamber. So when there's a blood stasis, that will lead to clots. And this is the most important complication of atrial fibrillation, can lead to strokes. So it's possibly responsible for 30% of the strokes. And as you grow older, even a higher percentage.
Wow. So increases a person's risk of having a stroke.
Yeah, that is most devastating complication of atrial fibrillation. So, in an elderly, you may not notice it when you do the ECG, but if you monitor them, you do see atrial fibrillation in elderly people who have stroke. That's one of the most common causes for stroke.
Hmm. All right,
And it
folks.
can also lead to heart failure. And most importantly, it disturbs the quality of the life significantly to the patient.
And let's just remember that, these segments are so important. The Medical Rundown Tuesday segments are so important because it's really about educating all of you, the listening public, about these different diseases and disorders and ailments. Because once you have more knowledge and information, the more equipped you are to hopefully prevent it, take lifestyle modification steps, as well as if you have someone in your life, perhaps a senior, and you've been noticing some behavioral changes in them, time to get them checked out, because this is certainly one of the possibilities. So AFib significantly, as Dr. Ravi just said, increases the risk of stroke, heart failure, and other cardiovascular complications because it really disrupts normal blood flow. So we have some stats here globally about how many people this is impacting. Do we have any idea in terms of the Cayman Islands population specifically? How many people?
Way back in 2014-15, we did a study called the CAFE study. It's a Cayman atrial fibrillation. Is concentrated on that. So we randomly recorded ECGs in all comers, elderly people walking into the hospital, and we did find pretty interesting data. We screened close to about 200 people, but we have not published this data for various reasons. So there is a significant burden of atrial fibrillation, unrecognized atrial fibrillation on the island, but we don't have any specific studies for the Caribbean region or the Cayman Islands.
That's interesting. So the research was there, but it hasn't been published?
Yes, we did the kind of it was presented in conferences, but we did not publish it because its numbers are not large. It was very specific for the island. Right. But it did show up a significant percentage of atrial fibrillation. We picked up asymptomatic atrial fibrillation in quite a few people and started them on the right treatment. So I guess we did ward off some strokes.
That's fantastic to know. At least some steps were taken. Often we talk about the importance of knowing your numbers. Is this something, Dr. Ravi, that will present itself much earlier? Are there indicators that you're heading in this direction?
So there are some classic risk factors for atrial fibrillation, which is actually common to most of the cardiac issues. As the age is the most important thing. As you grow older, the risk increases, and this is compounded, synergistically influenced by hypertension, diabetes, and poor physical condition, obesity, poor exercise, and very importantly, alcohol consumption. So if it's a single most reversible cause for having atrial fibrillation, it is alcohol consumption. It's in your hands not to drink, so that's the thing. But the other conditions which need to be controlled are hypertension and diabetes. And other important unrecognized, poorly recognized risk factor is the sleep apnea. People prone to sleep apnea, they're more prone to atrial fibrillation.
Very interesting. And I know
these are the most important things you actually try to address when you're identifying a risk of atrial fibrillation.
Yeah, we've definitely talked about sleep apnea here on this program, but so advancing age, some of the risk factors, high blood pressure, hypertension, a lot of people in Cayman do suffer from that as well. Coronary artery disease, heart failure, obesity, which will increase your chances of all of these other risk factors. So that's why that's so important, I'm sure. Diabetes, sleep apnea, excess alcohol consumption, smoking, and thyroid disorders. Very interesting. All right, folks. So if you are struggling with any of those, you definitely need to pay attention to this. Now, let's talk about some of the symptoms. How is it actually presenting itself?
Well, the commonest symptom for atrial fibrillation is palpitations. And palpitations, in simple terms, is an abnormal awareness of one's own heartbeat. So some people don't have palpitation; they're just present with shortness of breath, or fatigue, or dizziness, or sometimes a sudden onset of atrial fibrillation can lead to a blackout. That may be the initial presentation, because a sudden increase in heart rate in an elderly individual will reduce the blood supply to the brain acutely, and they can have a syncopal episode. And all other standard cardiac symptoms, if supposing they have some pre-existing blockages, the increase in heart rate can lead to some kind of a discomfort in the chest. So many people can't describe palpitation; they will call it as a chest pain. So it's the way they perceive a symptom. Right. And of course, very importantly, it can just be picked up randomly when the person walks into the clinic and you do an EKG.
Interesting. Now, heart palpitations, I feel like, are something that is very, very common. I was actually having some last week, and I chalked it up to lack of sleep because I wasn't sleeping particularly well. And so in the middle of the night, my heart was racing. Like if I got up to go to the bathroom, I was very, very aware of my heart racing. Is that something, if that's kind of by itself, is that something that I should come in?
There are several causes for palpitations, which means that there are several causes for the cardiac rhythm disorders. What atrial fibrillation is from the top of the heart. The more common symptomatic arrhythmia, if you look at across the ages, is from the bottom of the heart. It's due to extra beats from the bottom of the heart called ventricular ectopics. So the only way you can kind of differentiate this, trying to have an ECG at the time you have the palpitations. That's the most difficult thing, because when you can't just walk into a hospital in the middle of the night, when you have the symptom, right?
Right.
So that is so we find out, we discuss what's the pattern of the palpitations, historically, how the patient feels, and then we can make a kind of a reasonable clinical diagnosis of what may be the cause for palpitations. But the ideal thing is to have an ECG, and now with the availability of smart watches, that's become a fairly simple issue. Also, otherwise, if the smart watches can't pick up, we have to put them on monitors. So the point is, you have to catch the thief when he's at the job. So you have to have an ECG.
Yes, absolutely. That's understood. And you made me just think of the fact that, now that I'm thinking about it, I probably should have put on my smartwatch last week. But when I'm getting more rest, I find that, I really think it was a lack of sleep, because once I started to go to bed a couple hours earlier, I started to feel a lot better. So, yeah. Evelyn also shares that she sometimes get palpitations, especially if she drinks too much coffee. So there are other things can cause heart palpitations, obviously.
So just to clear the doubt, there is that kind of a Chinese whisper on the relation with coffee and palpitation. It's not true. It's been disproved that coffee is bad for, it's increases the risk of cardiac arrhythmia. It's not true. And of course, you drink loads of espresso, okay, it can produce some kind of a faster heartbeat as the usual effect of caffeine, but normal consumption of a couple of cups of coffee, no problems. We stopped advising them not to drink coffee when they have these issues.
Okay, so that's perhaps just an old wives' tale then.
That's right. It's a Chinese whisper, and it doesn't matter whether it's a decaf or a caf. So you can have your regular caffeinated coffee.
Okay. She does say that she had an ECG yesterday, and she's waiting for the results from Health City, and she's surprised that coffee is not the cause of her palpitation. So there you go. That's why we bring the experts on here, because they're going to teach us a thing or two. So it's also interesting that some patients may have no symptoms at all.
Yeah.
So
Yes.
that's when you mentioned, unless they go to a doctor, this is where your regular checkups are important, right?
Yes. So that's the important thing, when you walk into the hospital, your blood pressure is checked and your pulse is checked. So the most important screening thing is to just feel the pulse. The nurse should feel, or the doctor, they should feel the pulse for at least 1 minute. And if there is any irregularity, they should have an EKG done. That's the simplest screening tool, cheapest and simplest screening tool. And that education is so important for all the GPs and the nurse assistants who check in the patient.
Yes. Yeah. I've kind of always wondered, now that you mention it, literally the first thing you do when you walk into any sort of clinic is they want to get that blood pressure checked. So that's how important your blood pressure is to being
At the same time, the pulse should be checked, but not many people do it. So with the automation, sometimes the automated blood pressure machines do throw up a rapid heartbeat, which is again something which should lead you to a suspicion and then go ahead and do an ECG.
All right. Shortness of breath, fatigue, dizziness or lightheadedness, chest discomfort, reduced exercise tolerance can be some other symptoms of AFib as well. And then you talk about the way in which it's primarily diagnosed is you've got to get this electrocardiogram done, the ECG, and that's the primary diagnostic test. And they do have portable machines now, Doc, that they can holster you up to and send you home to kind of monitor you over a couple of days.
So you do have the Apple Watch, which is I think even the Samsung has it. But you can record an EKG whenever you have the symptom. It's it's a very good screening tool, honestly. And there are other monitors for people having frequent palpitations, and they are not able to. They last for a few minutes. By the time you go to the hospital, they disappear. There are other monitors available commercially, pretty well established. Something called Cardia Mobile. You have these with you. You can record the ECG when you have the symptom, and that is the sine qua non for diagnosis. Rather than other option is, we can keep putting people on 24-hour monitors, 48-hour monitors. But the Murphy's law is that when you have the monitor on, you do not get palpitations. So that's the problem.
Yes, like you said, sometimes it's difficult to catch it as it's actually happening.
It's so brief, so you will not get time.
All right. And are there people who you say, right, they're complaining about it, let's just have you come and stay with us in the hospital for a couple of days so we can monitor you?
It's no more really required. You don't have to stay in the hospital for monitoring. We can put monitors, 48 hours, 7-day monitors, and then they can be discharged home. They can go back to work, do everything normally, and it'll pick. Whenever you have a symptom, you just have to make a note of it, and it will kind of timestamp, and we can see the ECG during that time.
Okay. All right, folks. And don't forget that, yes, we are a little bit in partial vacation mode, but the phone lines are still open via WhatsApp. You can give us a call on the same show number, 936-2626. If you have a question for Dr. Ravi or comment this morning about AFib, please do feel free to give us a call. Again, 936-2626 is the WhatsApp number. So let's talk a little bit then about the diagnosis stage. When you actually get to that, you determine that there's this heart rhythm testing. And again, we've talked about the primary way to do that is the ECG, right? And also blood tests can assist in the diagnosis as well.
So once you establish the diagnosis, then you have to look for the cause. Right. So the other tests actually help you in looking for the cause. You do an echo to see if there's any structural heart disease, any heart attack, or any something called cardiomyopathy, which is a common cause for this rhythm problem. So we can pick up those, the structural issues on the echocardiogram. And the blood test fundamentally for the reversible conditions like thyroid disorders, etc. So that's in a much younger person, you have a link between high thyroid hormone levels and atrial fibrillation. But that's if you look at the hierarchical causes for atrial fibrillation, it's not that common, but it's a part of the diagnostic armamentarium. Most of the time, you may never actually see a cause. We call it as so-called lone atrial fibrillation because we're not able to really pick up something. So that's how the concept that as we age, the risk increases because of there is a lot of fibrosis in the heart muscle, and this fibrosis leads to the electrical short circuits, which in turn leads to arrhythmia.
All right. So very good to know. Thank you so much. Now let's talk then about you get a diagnosis. Does this mean that you're definitely going to have a heart attack? What is your prognosis from getting a confirmation of AFib? Is this something that is now manageable and people can live many years with?
So it all depends on once you have diagnosed atrial fibrillation, we estimate the risk of the patient. We have a certain scoring system where we give points to the various risk factors associated hypertension, diabetes, the sex. In fact, the female sex gets a point. They're at a higher risk of a stroke when they have atrial fibrillation. And heart failure. So we give points to these and make a risk assessment for the risk of stroke or any other event. The most important thing is the type of atrial fibrillation. It could be one-off episode due to binge alcohol drinking. You heard of a term called holiday heart syndrome. We see it commonly here. People come flying to the Cayman Islands. They're on a vacation mood, drink 10 beers and 12 beers and a shot. We just have one patient in the triage right now. And then they develop atrial fibrillation. This is a reversible cause. And I guess just giving a simple medication will terminate it. And then that is it. We have to counsel them not to have a drink anymore or try to limit the alcohol binges. So this is fundamentally in a first episode of atrial fibrillation. But some people keep getting it recurrently. It may be in months or years, but it's called paroxysmal atrial fibrillation. And the third one is when it's in atrial fibrillation all the time. That's called persistent atrial fibrillation. So the treatment paradigm changes with respect to each kind of things and all the other associated factors, the age, the blood pressure, diabetes. So it's a kind of a holistic treatment. But the fundamental important thing is we have to recognize the risk of stroke and start treatment with blood thinners immediately. That is by far the most important thing. So once you have got that under control, then you can try to reduce the symptom of palpitations by giving medications which slow the heart rate. So you are able to achieve that. Now the mantra is God has given you a normal rhythm, so you try to get back the normal rhythm. So that's called the rhythm control, where we can establish a normal rhythm by either giving a shock. Establishing a normal rhythm is under anesthesia. It's a very common procedure. Or we can give medications to maintain the normal rhythm, or we can do a curative option called ablation, where we try to look at the drivers for atrial fibrillation and kind of destroy them.
And how do you do the ablation? That sounds very interesting.
So fundamentally, the atrial fibrillation is supposed to arise from structures in the heart called pulmonary veins. I can show you again on a video if that's
yes.
If you're able to see that. This is the heart. So these structures are called the pulmonary veins. These are the back of the heart. So the extra beats which come from the pulmonary veins will permeate into the heart muscle and trigger the short circuits. So what we do is we target the pulmonary veins and we destroy the connection between the pulmonary veins and the heart muscle. And this is done either using a heat technology called thermal ablation, radio frequency, or cooling technology called cryo. At Health City, we commonly do the cryo ablation for atrial fibrillation. But the main problem is the real cause for atrial fibrillation, in spite of decades of research, is still not clear. So when you're not able to identify the thief, you can't really, we may be putting an innocent person in jail, right? So that's exactly what happens with ablation. So the success of the procedure is close to 70 to 80%, but it's never 100%.
Very interesting. Wow. Thank you so much for your diagrams as well. I think they certainly help to understand this a little bit better. And of course, you talked about medication. What types of medications are normally prescribed to control AFib?
So 2 types of medications. One is to keep the pulse rate slow. I mean, we use those drugs called beta blockers. You heard of blood pressure pills called metoprolol, atenolol. These are simple drugs.
Yes.
Or diltiazem. These are common drugs. Many people are aware of those names. Or we try to give some specialized medications to maintain the normal rhythm. So they're also available. But the problem is you have to take these medications lifetime. And when you take anything lifetime, you're, consenting yourself risk of side effects, which are all real. So that is the main problem of the risk of blood thinners is that there is a risk of bleeding too. So you have to balance the risk of bleeding and the risk of stroke.
Wow.
So that's where a structured program is vital to manage these patients carefully.
Yes.
Follow them carefully.
Yeah. And once you get them on a prescribed treatment, then how often do you actually do ongoing management and monitoring, to make sure that they don't have any of these serious complications and that the medication's actually working?
So actually nowadays, the most important pillar of management is the lifestyle. There's a strong link between weight, obesity, and the risk of atrial fibrillation. So weight reduction is actually fundamentally one of the most important pillars of management. And of course, the abstinence from alcohol, treatment of other risk factors which can contribute to the cardiac structure dysfunction like hypertension, diabetes. It's not limiting alcohol intake, it's actually stopping alcohol. I think that's the most important thing. The message to be conveyed is stop alcohol ASAP. And if if they can't do that, then limit alcohol. And if you have to limit alcohol, stop beer. So many things cascade on. But the most important thing is no alcohol.
No alcohol. All right, folks. So here are some of the AFib prevention tips. Maintain a healthy weight. And again, that's every single disorder practically. That's one of the top ones at the top of the list. So that shows you how important weight control is, because of course the weight impacts other things such as controlling the blood pressure, managing diabetes, limiting your alcohol intake, treat sleep apnea, which again is connected to all of these other things, including weight, blood pressure, and diabetics tend to have, multiple comorbidities when it comes to, these sorts of things. So get regular cardiovascular checkups. And that is one thing that we, stress here on the program. I know that Shamar and his team are always offering a variety of specials around the very, very important executive health check. And one of the key things that they do in the executive health check is they're going to look at all of these things. They're going to definitely be checking your heart function to make sure that your heart doesn't present anything that's obviously wrong. So those checkups being very, very important. So let's talk a little bit then about your AFib clinic. Health City has really committed, Shamari, to doing these clinics where you're getting experts together into one key area. We see like the women's clinic. We see now the AFib clinic, which one? We did another one recently as well. You've got the sleeping clinic. So tell us a little bit about the concept before we get into the details with Dr. Ravi. Tell us about the concept of how the clinics work within the Health City ecosystem.
Hey, Sandy, and it's usually we have great physicians.
Mm-hmm.
So like Dr. Ravi will come to us and he'll have a great idea about how we can actually, one, have clinics in order to detect these types of diseases and issues prior, so that we can either help through, modification of diet or alcohol intake, like Dr. Ravi is saying, and also look to see if there is an issue, whether or not there needs to be treatment. So the
Right.
one way that we're able to do it is to have these clinics whereby we get Dr. Ravi and other members of his team to be able to look at patients within a certain setting to be able to tell whether or not they have the risk factors and or if they're starting to already have the onset of the issues to be able to proactively deal with the population. A lot of times um, we have conversations with the physicians, and obviously they're coming from one of the most populous, if not the most populous country in the world. And here we are in the Cayman Islands with 80,000 or at most probably 90,000 people at this point in time.
Mm-hmm.
And they're saying, we can make such an impact if we're able to understand and reach people quicker and at
Mm-hmm.
earlier stages. And by having these types of clinics and educating and getting persons to come through the door, we're looking to have more prevention than the actual cure on the back end as well.
Mm-hmm. All right, so let's talk about the specifics, Dr. Ravi, of the AFib clinic and what patients can expect as a result of this.
So the concept of any clinic is a structured follow-up. You can have clinics in, the most common problems affecting the population. Having a specialized clinic allows for a better follow-up, better management, more kind of focused management of the reasons for the problem. So, for example, you have a patient with atrial fibrillation. You put him on. The aim of the thing is he should not suffer the consequences of atrial fibrillation. So you call them for frequent visits and ensure that they are maintaining the lifestyle advised, the weight reduction, alcohol, abstinence, exercise. So you ensure all these are happening at least on telephone follow-up or in-person follow-up. You will have a nurse who does many of these tele follow-ups. We are training a nurse for the same thing. And also you ensure that, as you age, you can have kidney issues and other things, and you're on blood thinners. So the blood thinners can increase the risk of bleeding. Uh-huh. So you're following up on all these additional risk factors which can complicate therapeutics. So fundamentally, that's what is the aim of the clinic. So we are going to have it, it's not on specific days, because the volume of patient doesn't justify specific day clinics on the island. So we are having it on every day. We document them, the entire history on the medical records separately, and then have a more structured follow-up as compared with a regular patient.
All right. So inquire, folks, if you suffer from AFib about the clinic. I think one of the great benefits of having this available is that you can just continually manage it. You've got a team that is following you very, very carefully, and they're aware of precisely what your case management specific to you requires. And I think that that's obviously very, very important when you have an ongoing issue.
Yeah, many of these are lifetime diseases, except, the alcohol-related acute. So when you have a lifetime disease, like say for diabetes, you need a specialized physician or endocrinologist to keep following up regularly. Similarly, it's the same thing. I mean, once you have AFib, you're likely to have it unless it is cured permanently.
Mm-hmm. All right. And is there some sort of permanent cure?
Ablation is supposed to be purported to be the permanent cure, but like I told you, we are still not understood the mechanism of atrial fibrillation perfectly. So when you don't understand the mechanism, the cure will not be perfect. But we are reaching there. It's about the success for atrial fibrillation in what we call as paroxysmal AFib is close to 80%. And with other forms of AFib, it's about 60 to 70%. So 80% is pretty good. So 8 of 10 are able to be free from AFib for at least a period of time, or in case the cells regenerate, they can have it back. So we are reaching there, and the forms of energy are also used for the treatment of AFib or improving. So the procedures are shorter and much safer now. The risk of the procedure is pretty low. So we are getting there, but we are still, it's a holy grail of cardiology.
Mm-hmm. Very good. All right, folks. No questions today, 936-2626. If you do have a question for Dr. Ravi before he leaves, please let us know. Irvlyn says that she doesn't play around when it comes to her executive health checks. She is doing them twice a year. Wow. Good morning to Lavana. Ms. Dean is here saying much love, Sandy and CMR family. We do have one question from a listener for you, Shamari. So this person is having an issue with the app. And so they were wondering if you could give an update. Let me just pull this one up here for you. They essentially are saying that please ask Shamari if he could find out when the doctor visit notes will be seen on the app, as it was down a long time. So any updates on any app issues and perhaps when those would be fixed?
Yeah, I would have to check with the IT team, but I know somebody was using the app as late as 3 days ago and was commenting on how they were able to actually navigate and book and do everything on the app. So I was unaware that the app hasn't gotten the notes back up, but let me definitely send her a message to the IT team and check. And if you have that person's contact details, then I'll make sure that we get somebody in contact with them as well.
Absolutely. I will do that. And I keep feeling like I'm one of those people who needs to be using the app, but I'm not. So, I need to get with the program.
Yeah, no, the app is great. People, you're able to get your appointments with your physicians. You're able to see all of the medical records and everything on there. So, yeah, definitely, we're gonna get you hooked up. Make sure. I think you already downloaded the Connect as well. We just need to make sure you got your MRN in there, and then good to go.
Yes, I'm committed to. I'll put that on my February list. I got 2 more weeks, February list of things to get done. Because I mean, I'm there all the time, so it'd be great to be able to have the app right on my phone. All right, thanks so much as well to that astute listener to the program for reminding us of how to get the app up and running. All right, Shamari, any final comments for today?
No, just that Dr. Ravi is always very efficient and succinct, and thank Dr. Ravi for taking time out of his busy day to come here and to actually tell us all about AFib and the clinics and what he can do. And I'll always remember when I first started with Health City, and I thought I was reaching there early at 6 o'clock, and Dr. Ravi, I would hear a conversation. I would go in the conference room, and Dr. Ravi was having clinics and discussions with physicians and patients all the way in India from early in the morning. Because even though he came here to Cayman, he was still so valuable that they didn't want to let him go, and he needed to also manage 2 patient loads as well as give advice to physicians back in India. But now we have Dr. Ravi many years later. Hopefully he is just for us. I don't know if Dr. Ravi is still giving all of that advice, but all of our patients love Dr. Ravi, and we just thank Dr. Ravi for being a part of our community and doing all the great things that he does for Health City as well as the Cayman Islands.
Thank you.
Fantastic. Dr. Ravi, any final comments for us this morning?
I guess nothing. Lifestyle is lifestyle. That's the mantra now. Prevention. So lose weight, exercise, no alcohol, eat healthy food.
What do you say? Not too much wine, Dr. Ravi. That isn't good for your heart. Huh?
No wine, no alcohol. The wine myth is wrong.
Yes. Oh wow. I know that's challenging for some people. But the messaging, Dr. Ravi, around alcohol is becoming more and more crystal clear, right? That there is no safe level of it at all.
It's crystal clear, except some US guidelines are confusing again.
Oh gosh.
Like they want you to eat more steak.
leave it to the US to confuse you.
But no alcohol. Yes, clear.
Yes. Okay. All right. All right. Very good. Well, Shamari and Dr. Ravi, thank you so much for joining us this morning, and some good advice around AFib. If you have any questions or concern, of course, you can always reach out to the Health City team. info@healthcity.ky is their contact number. 640-4040 is their telephone number. And don't forget, they actually have 2 locations right here in the Cayman Islands to serve you. One is the original East End location, and of course, the Camana Bay location, which has been open now for a year and a half. Yeah. So Lucky Body says, wow, alcohol is really bad for us then. Yeah, I know. Some of us are like, really? Don't say that too loudly, Sandy. But yes, yeah. What can I tell you? You got to pick your poison sometimes, and the less of it you have, obviously, the better. All right, thank you again, Shamari Scott and Dr. Ravi. Have a beautiful Tuesday.
Yeah, thank you.
All right, wonderful. So yeah, Lucky. Ooh, I mean, I gotta be honest with you. I've been seeing a lot of stuff that it's like, it literally is poison. Like, it's no better for you than smoking now, is the conclusion that they're coming to. And it doesn't really matter, I think the messaging is so interesting when he said about, the Americans confusing the messaging, right? They have JFK right now, who is, what is his official position again? He's not a qualified doctor, but, he's an appointee of the current cabinet. And he's given people medical advice that is like so wrong on so many different levels. Let me just check his position. What is his current position? He is the United States Secretary of Health and Human Services, and he was confirmed by President Trump in February of 2025 after he was elected president of the United States again. And unfortunately, this man has zero medical qualifications for this position, unlike the former guy. And so the things that he says are oftentimes not founded in anything medical at all. He doesn't even seem to talk to the medical experts. So he is a former environmental lawyer, which is interesting, an independent candidate back in the 2024 election who endorsed Donald Trump. And that's why he got the position that he did. And so, yeah, it's pretty wild, because what falls under him, he oversees the federal health agencies, including the CDC, the Centers for Disease Control, the FDA, the Food and Drug Administration, and the NIH, which are supposed to focus on initiatives to address chronic diseases and food safety. And now, if you know what they're doing with food safety and even the medical advice that you're getting, it is pretty wild. It is crazy out there. So yeah. Okay. So we will, what can I tell you? Except that we will continue to monitor that situation. In the US, they are having a measles outbreak at the moment. And so again, this sort of anti-vaccination position that they have been taking over the last couple of years is coming back to bite them quite literally. And people are starting to die from diseases that were largely let's see, that were largely under control and in some instances almost wiped out completely thanks to vaccinations. Yeah. Let me just having a look at something. My apologies. I didn't realize that we were not on radio. So I'm just trying to get that sorted out. Okay. Okay. All right. So 936-2626. Well, lines are open. Okay. Right. All righty. So you guys having a good one? All right. Let's talk a little bit about the weekend. I know yesterday we kind of really got stuck talking about the unfortunate stabbing that we had over the weekend. I do want to speak a bit more about the positive things that happened over the weekend. So big shout out to the Ministry of Youth, Sports, Culture, and Heritage. They had a very, very successful weekend in terms of the Bluff premiere movie. And so by all accounts, it was amazing. It was successful. A lot of you attended. My apologies. A lot of you attended the Pedro Castle location. I think over 600 people were there. And yeah, I mean, I heard the movie was fantastic. You guys absolutely loved the movie. And then Frankie was there taking pictures and so on with people. So that was good. And let me just see here now. Okay, so I think that based on the feedback that we have received, it was really, really an enjoyable time. So we're going to post up some pictures a little bit later on. Of course, Cayman Brack also had a good turnout. And by all accounts, people there really had a fantastic time as well. Let me just see here. I did get some pictures, so I'm going to post those up a little bit later on. So that's great. I mean, it's amazing to have a Caymanian, making strides in their profession, especially one that's kind of tough to get into. And yeah, we are very, very proud of Frankie Flowers and the strides that he's made. I wasn't obviously able to see the movie at the premiere because I'm not there, but definitely over when it releases on Amazon Prime, I'm going to be one of the first ones logging on to watch it because it looks really, really good. I love me a good action flick. Lots of action. Good morning to Strong Wilt. How you doing, honey chow? Shamari. Johan says, Dr. Shamari getting blazed up today or what? His segment is done. So someone then says everything comes back to lifestyle, diet, exercise, and sleep. No escape if we want to have good health and a good quality of life and also good life expectancy. And that really, you're absolutely right. All of it. It's a combination of things. It's a combination of the diet being very, very important, the exercise in conjunction. And within each, you got to look at, what does exercise mean? You've got to do cardiovascular, but the strength training, which I feel like is something that is oftentimes kind of, it doesn't get the attention that it should. From all that I'm reading and the research that I have been, looking up, the strength training is probably the most important part of it, really. And even in terms of your cardiovascular health, the strength training is really, really important. So if you're just doing cardio, if you're just running and walking and you're not lifting weights, especially as you age, you might want to really look at a good program to incorporate that into your life as well. And then the craziest thing is you can have an ideal diet and you can be exercising, but if your sleep is compromised, and this just shows you how some things, you got this, like what's most important. the research also demonstrates that if your sleep is really, really a poor quality, you're not getting enough sleep, that will actually mess you up so badly. I've been reading this. I'm disappointed because I'm not the best sleeper. So I gotta get it sorted out. That no matter what else you're doing, if your sleep is compromised, it almost erases the benefit of a good exercise program and a good diet, which is wild when you think about it. But that just demonstrates how important sleep is. That is when your body is repairing itself. So, you can be fit. You can have perfect diets, getting all your macros and all this stuff that they're always talking about, eating lots of vegetables, getting sufficient protein, but not overdoing it, all these things. But ultimately, if you are not getting good quality and enough sleep, you're undoing everything else. To me, that's like, whoa, it really is mind boggling. And of course, Health City has a sleep clinic and they can help you if you're struggling with sleep as well. I just got to get in bed earlier. Like once I'm sleeping, I'm normally pretty good. If I'm not stressed out about anything. And I'm at the age now where I'm not letting too many things stress me out anymore. I'm like, honey, chill. You ain't going to be stressed out, auntie. I'm going to just click, turn it off, get in bed. But the getting in bed part, that's the part that I struggle with because my list of things in any given day is like outrageous. And then I find that at night, it's so weird, right? Like at night is when you get things like when the baby goes to sleep, she's sleeping. Then I'm like, okay, everybody's fed, everybody's sleeping or whatever. That's like when I get like a second wind to kind of get things done. I think a lot of people fall into this trap. And then before you know it, it's like 1 o'clock in the morning. And then you're like, oh man, I got to be up in 4 hours or 5 hours. And yeah, so I'm trying to use certain tools now. Like I've got my little, like you talked about the smartwatches. I do have it set up on, I think it's my Apple, on my phone, where it'll remind me, hey, like I've told it what I want my bedtime to be, but I think I need to adjust it, give myself an extra hour. And it'll say, your bedtime is, right now I have it set to 11, but honestly, I think I need to be in bed for 10 o'clock. And just move that up an hour. And then by 9 o'clock, it's going to start saying to me, your bedtime's in an hour, start winding down, start wrapping up whatever you're working on. And I think that helps. We all got something to work on, honey child. You're lucky if you only got one thing. But yes, Anthony asked this question yesterday. Anthony, I'm going to be honest with you. I don't know anything about the Freddie McGregor concert. I didn't even really know that he was here. Somebody, I think one person sent it to me. But is this something that was not done by private people? Because I thought his daughter, who's that young lady, Zosha, I thought they brought him in. I wasn't aware that the government was bringing him in. So I know you asked the question yesterday. What makes you think that the government brought him in? Do you know that for a fact, or are you thinking it was the government? Because I didn't really see any. I didn't see any indicators that was actually what was happening. So I don't know. So I can't speak to what I don't know, I'm afraid. So his question is, do you think the government got value for money for bringing Freddie McGregor to the Cayman Islands in his physical capacity to do a concert? So amazing how we help foreigners in any condition they appear. So again, does anybody know anything about this? Because I'll admit that I actually don't know. And I can ask who brought him in specifically, like what ministry was this? Was this tourism? Like who? I don't know, because there's obviously different ministries that can bring someone in. But I will ask around, but I'm not aware of who brought him in. I would have thought, because the clip that I did see, it looks like it was his daughter who was promoting it. So I assumed there's a private function. So I don't know. Let me ask somebody in government. Let me see here. Which ministry should I start with? Let me start with culture and heritage. But I didn't see them promoting anything. So, but to your point, again, you know, if it's not the Caymans government, that I honestly don't care who brought him in, if it was private sector. But did send me a video of his him with his daughter and some other people, and I think that you I take your point. I mean, he didn't look all of that healthy. He looked a little bit shaky, and I think it was, I can't remember if it was Everything 345. Somebody had it up. And of course, most people are positive because they love Freddie McGregor, right? They love him. They love his music. So they weren't really focusing on how he looked. And I don't know how he performed. I have no idea. I didn't hear anything about the concert. But point taken that he did look a little bit shaky. I mean, I'm not going to lie. I did look at it, and he looked... he didn't look all that great. Hold on, I'm getting some. Okay, I'm trying to get some information. So it looks like they probably had government as a sponsor. I don't actually know if government was like the headline. Let me try and message maybe one or two of the ministers and trying to see if I can get to the bottom of this. So, you know, sometimes individuals will put on a sponsor or a concert, and then they get government to partially sponsor elements of it. But yeah, I mean, listen, I cannot deny that the video that I saw, bless his little heart, he looks like, you know, he didn't look like he was doing too well in terms of his health. And I think someone made the point about, you know, the condition that he was in. And I honestly believe that, you know, I don't know. Listen, when you're an entertainer and maybe your finances are not in order, you kind of have to continue performing at any age, really. You know, it is what it is, right? But yeah, I don't know. Someone sent me a Everything 345 post. Let me see if I can find it now. And they were like, look at the comments. So let me just have a look at this. But Anthony, I do think that the government has a responsibility to make good fiscal decisions when it comes to who and what they decide to sponsor, especially, I don't know what they get in return. I don't think they really do get anything. So this is a video of him performing. Okay, let me play this video, because I think if you play this video, this is 345 happening, that they did a video of him. You do become cognizant, let me put it that way, of the fact that he doesn't really look that great at all. And it probably wasn't the best performance. And so Anthony's point is, you know, why would government be sponsoring this? I think he probably has a valid concern. Now, I don't know if you went to the concert, Anthony, but let me see. Let me just see if I can get this really quickly. Okay, I'm going to put the URL in here and see if I can download the video. Yeah, he looks a little bit shaky, low key, you know, even on stage, he's not really looking good. But I did see the pre-video, I think when he came in, or he was at the airport or something like that, and they were like promoting like, oh, doesn't he, we're like so excited that he's gonna be in concert, and Zosha was there, and I was like, he looks like he needs to be in retirement mode. So yeah, kind of sad still. So Victor says he came on stage. Good morning, Dr. Victor Lokloy. Give me 1 second. Let me see if I can get the video up here. So it says he came on stage 4 minutes to midnight on Saturday. 4 minutes to midnight, but aren't shows on Saturday supposed to end at midnight? So are you telling me that he only performed for 4 minutes? Well, that doesn't sound too good. Anthony says it is a ministry supported showcase. Which ministry? That's what I need to know. What I saw at the show for 5 minutes, he was there, was not worth the government's money. Oh, okay. Yeah, I mean, if he came on 4 minutes before, you're lucky you got 5 minutes out of him. So let me try to ascertain which ministry, because that's the question we got now, actually sponsored this. Minister Jay and his team. Ooh, boy. Okay. Oh, someone says it was a John. They think it was a John event. Ay, ay, ay. Caramba. All right. Someone says that they think it was a John event. And of course, you guys know, I continue to say that ministers who are elected officials need to stop dabbling in other stuff, including other businesses, because there will be times when there's going to be even an apparent conflict of interest, and that's a problem that should not be happening. There's quite a few ministers that are in businesses that they are actively involved in. Oh, I have my daughter running the business. Okay, that's not far enough of reach, and so I think that they need to, being an investor in business is one thing, but being actively involved in the business, and it doesn't sit well with me. So when you get other government ministers and officials supporting it, you kind of low-key ask the question, like, why is this being supported? So John was involved in this. That's no surprise then that it probably got the support of the government, because he still has, connections with the ministers that are there. All right, let's look at the footage that was posted on.
Darling, how I love you. I gave all I had. They tried to take you, and now I'm so mad. But that's the way to love. That's how I feel in my heart. I've got to say, oh, how I suffer. Oh, how I try.
Okay.
I gave up my pride.
Poor thing.
Be by your side. And whosoever tried to take the love that's really mine, I've never seen no other word, no other word. And before the night, I tell it, let it shine, let it shine, let it shine, let it shine. And I believe this is a prophecy.
So I think this is really more about the backup dancer. Somebody says those are his sons, and I see Zosha there on stage. So it's more like the backup performers and the backup dancers are the ones who are really singing, not so much him. Poor thing, he can't even stand up. I mean, he's sitting. So yeah, there's probably, I don't know what they paid to get him here, but I'm not so sure that they got value for money. What was the venue? Where were they? He sings a little bit, but yeah, he sounds shaky. I mean, Anthony says Mr. Berman Scott could have done that. Like what? Mr. Berman Scott would have been giving you a good little performance, honey child. Yeah, low key. I feel you on this, that this probably wasn't any value for money at all. And let me just see here. Let me just have a quick look. I want to see where I do want to see where I think it was Everything 345 that had the interview of him. And I do recall thinking to myself, he looks like he should be living his best retirement life, not coming to be in a concert. They shouldn't be stressing the man out at his age. Let him retire. Like, you work hard your entire life, and at some point, you got to retire. But you see, I don't think his sons, because I don't know any of his sons, I don't think anybody else in the family is known except him. So they got to bring him on stage. They got to market it as Freddie McGregor is going to be there for you guys to show up. Because I know if Zosha's marketing it as herself, nobody ain't showing up to that. Sorry, but it ain't happening. So, they market it as the Freddie McGregor show. Have him come on for 4 minutes, and then that's the value that you're getting. No. Oh yeah, here's the it got a lot of love on social, on Instagram for sure. The Roots Rock Reggae concert, apparently. It was called Freddie McGregor and the Big Ship Crew have just arrived in Cayman for the pre-agriculture show at the Stacy Watler Agriculture Pavilion and Fairgrounds in Bodden Town. That's where it was. So, all right, let's look at the footage that Everything 345 shared. Big shout out to the crew over there. Those are friends over at Everything 345. Let's see here if we're going to use their video to kind of show you guys what he looks like at the airport. This is what I saw before. And again, I thought, looking kind of shaky, my brother. Hopefully he can get to enjoy his retirement. They don't have to keep dragging him out. He actually looks like he's had a stroke. In fact, based on how he looks, which is really, really sad. Of course, So let me just show you guys this one. Because, yeah, poor Freddie looks like he's had a stroke. He doesn't look good. So here he is.
Sean, as you can see, the Big Ship family is live and direct in Grand Cayman. We are here for Roots Rock Reggae, and we can't wait to see you. Your girl Zosha, Captain Freddie, I have Stephen the Genius McGregor here, and Chino McGregor. Make sure to buy the tickets, them no.
I have to sing to the song. Bodden Town, but there, things sort out.
I'm gonna catch this flight, and when
Did I just see him in a wheelchair? Hold on.
Bodden Town, but there, things sort out.
Yeah, I think that was him, right?
The tickets, them no.
Somebody's not.
I have to sing to the song. Bodden Town, but there, things sort out.
Is that him in the wheelchair? I kind of think that's him in the wheelchair.
No.
I have to sing to the song. Bodden Town, but there, things sort out.
I'm gonna catch this flight, and when I reach my destination, I hope you'll be smiling, longing to see me. I thought you'd drop me a line just to say hello.
Okay, yeah, I see up at the top the ministry thing in the flyer. I didn't actually see them promoting it, to be honest. So I didn't even know anything about it. But I do see a ministry sponsorship thing up at the top there. Good eye, Anthony, good eye. So, yeah, he does look like, unfortunately, that he's had a stroke. Poor thing. Bless him. Oh, my gosh. Aw, poor thing. Can y'all just leave the poor man alone? Let him enjoy his last years. Irvelin says he's had strokes and has gotten a fast way. That's therapy for him. I love him and his music. Marshall says, yeah, he definitely needed to stay home. He should be anywhere but sitting on his porch somewhere in Jamaica countryside. Irvelin says, Auntie, he loves what he like you think he loves what he does. Maybe, but sometimes you got to know when to throw in the good old hat in the ring. You got to know when to fold them. How does that country song? You got to know when to hold them and know when to fold them. Sandy, his eyes are always big. What does that mean? Like literally big or something else? Lady D, good morning. Blessed Tuesday. Barbara says, I think it's sad to embarrass that old man. Well, Anthony says, when it's our money, I'm sure this is what Anthony's thinking, who's the embarrassment on? We're not trying to embarrass him. I think the embarrassment is that anybody would actually put him on stage in his condition. And when can we be honest with people and not worry about hurting their feelings or embarrassing them? Like, you, the family, are responsible for his care, and maybe the embarrassment should be on them, not on him. Freddie McGregor is a legend, but who puts him in concert in his condition? I don't know. I'm just saying, I would have been very disappointed to pay. I don't know what the tickets were going for, but I would have been very disappointed to even pay $25 to have him perform for 4 minutes. I didn't go there to see his kids. So, we're not trying to embarrass him. I take Anthony's point that sometimes we just need to perhaps do better. Okay. This person said, I heard him in concert before, and that doesn't even sound like him. He must be doing that for free. He looks sick, and he's using a walker. Yeah, that's him. He's sick. He can't even look up. Those selfish show-off kids. I mean, I think, sadly, the embarrassment should be on the children and not on him at all. So I want to be very clear. No one here is trying to embarrass the legendary, because he is a legend, Freddie McGregor. But I think one has to be realistic, quite frankly, about, what it is that you are, what it is that you're doing. I'm just saying. Poor Ting. Aw. I actually feel sorry for him. That's so sad. Lord have mercy. When other people have to, rely on a third person, like his children probably relying on him to get on stage, for people to even show up for them, that's kind of where the problem, I think, most likely lies. So yeah. No bueno, no bueno. I don't like that. Let me just read a few comments here. This other person says, dun, 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 dun. One person said it was not promoted. What the hell? I think he did have a stroke. He's like 70. It was not promoted. Well, like I said, I'm not really in that scene anyway, but I definitely knew nothing about it. Freddie performed at the annual Roots Rock Reggae concert put on by the Agriculture Department. Please be reminded that Freddie had a stroke a few years ago. Yes, that's before I even saw your message. I think that's obvious. This is the way he's been performing for years, so K-Man knew what they were getting. Oh, really? So, okay. Again, I did not know that. So he's been performing like that for years, and you guys okay with it? Huh. Interesting. What was the turnout like? Like maybe, yes, he's been performing like that for years, but if nobody's actually showing up, even if the Agriculture Department is sponsoring it, if no one actually shows up, maybe there's something to be said for that. The person goes on to say that he travels with a nurse, which would make sense given his condition. My goodness. Like I said, I'm not so sure he should be traveling not at all, really. But anyway, okay. Another person says that he had a stroke back in 2022. Wow. Someone says towel. They are wicked. Okay, another person says he can't even look up. Those selfish show-off kids want him to die now so they can get dead left. Lord Jesus, no. Those two guys with the locks were his sons. They're the ones that keep pushing that sick man to still be on stage. Yandy Phillips' daughter is with one of his sons. Okay, what a hot mess. Jamaica sauce. Good morning. He did have a stroke some time back, says another person. Hi, was just talking about that same Freddie stuff. Yes, he had a stroke. Don't know if more than one. You look great. Well, thank you. It's a little bit cold today. I don't know what the temperature is, but it was in the 50s last night. So I'm like, brr. Another person says, morning. I think that Freddie McGregor had a stroke a couple of years ago. Okay, we got that. Thank you very much. So it was the Ministry of Planning, Lands, Agriculture, and Infrastructure. So Plahi will reach out to them. This person says that poor thing comment took me out. Lord have mercy. They got an extension. Good morning. They got an extension. An extension. Who got an extension? Oh, they didn't go till midnight. So he performed for more than 4 minutes. Whew. Okay. All right, honey child. That's good. So another person made it clear it was not the Ministry of Youth, Sports, and Culture. I was wondering. So this is something they do before the, do they do this concert every year? I've never even heard of it, to be honest. But speaking of the agriculture show, let me tell you guys, take out some of the notes here, honey chow. I do want to remind you guys of the agriculture show that's coming up on Wednesday, which is tomorrow, because tomorrow is a holiday. So yes, honey child, there will be no show tomorrow. I will not be here. I'll be sleeping in. That's what I'm going to be doing in the morning. All right. So, let's talk about the agriculture show. So there's a couple important things that you need to know about the park and ride, for example. So the annual agriculture show is happening tomorrow, and they're encouraging you to utilize the park and ride feature, which means that you skip the traffic. Because, you know, when you go all the way to the venue, there's no parking anyway. So it kind of makes sense. I think I'm going to start trying to walk there because I'm within, I think, a couple miles. Like I could walk that, you know. Especially if it's not too hot. The thing is, if you're buying trees and other stuff, sometimes, you know, but maybe we'll go like early, buy trees, because Marlon loves to buy trees at the agriculture show. Y'all know he's a yardie from the countryside. So make your life easy, please, by parking. No circling for parking, no traffic stress. They're going to have 2 dedicated buses to and from each location. That's nice. So 2 from each location, running continuously throughout the day, taking you straight to the entry gate of the show in cooled, air-conditioned comfort. So you can sit back, relax, and even scan the QR code on board to view the program for the day so that you can plan exactly what you want to do before you arrive. I like that. Mess with them. Little QR code technology there. So the idea is that you're going to park, ride the bus, and enjoy the show. Now, here are the park and ride locations. So please make a note of these. We've got the Joanna Clark Primary School in Savannah. Nice. We have Jason Avenue there on Shamrock Road. That's also a very convenient location. We have the Theolin McCoy Primary School in Bodden Town and the Church of God Multipurpose Hall and Shamrock Road. And I think that's the one. Is that the one that government has been given money to try and get them to hurry up and finish the shelter? Because Julie claims that was the Honorable Juliana O'Connor Connolly claims that is supposed to be a hurricane shelter as well. If it's the one that I'm thinking of, that's the one that's right across from, is that the one that's across from Big Is Jerk Stan? I think. If it's another one, let me know because I can't keep up. We got so many churches, I can't keep up with where they're all located. But I believe that's the one. Church of God, that's what I grew up in, that's the denomination that I grew up in back in the day. Yes, honey child. We are Church of God folks. So anyway, this is convenient, comfortable, and it's a smart way to get back to and from the agriculture show. You park and there'll be ample parking. They're going to set all of that up and you just jump on the bus and enjoy the annual agriculture show experience. So don't forget that this is the Agriculture Show 2026, Ash Wednesday, which is tomorrow, February the 18th. So let's ride. And we did post a reminder about the show last night on social media. In case you forget, it is happening from 7 a.m. to 6 p.m. in Lower Valley. Lots of food. It's one of my favorite events to go to actually for like the local food vendors. So they've got food, culture, farming, and fun for the entire family. And I also like to support the businesses. So there are a lot of Caymanian owned arts and crafts and people selling plants and all sorts of stuff. So the earlier you go, sometimes the better because you get the good plants in the morning. And then they have a whole day of activities for the family. Next year, I think I will try to be there next year. It's kind of hard though, because this is the week that they do the school break for the kids. So, you got to take your vacations around your kids. But if I'm there next year, maybe I will live stream from there. Ta-da! I like the idea. So maybe we'll do an on location. We can go around and talk to some of the vendors, and that'll be on CMR radio. All right, great vibes, great people, and lots of prizes for grabs all day long. Follow them on Instagram. The Cayman Agriculture Group has the Cayman Islands Agriculture Society, in conjunction with the Ministry of Agriculture, puts this on. And you can follow them on Facebook and Instagram and all the details. So here's what you need to know in terms of tickets. This is the 57th annual Cayman Islands Agriculture Show. Entry tickets, $10 for adults, $5 for children 12 and under, and 2 and under and seniors over 65 are free. Raffle tickets. How much is a raffle ticket, by the way? I think it's a good amount, right? So the raffle ticket, or those tickets are different. Those are $25 if you want a chance to be entered into the raffle. It is at $25 for those tickets. So congratulations to the Cayman Islands Agriculture Society and the Ministry of Agriculture who put this on like that every single year. 57 years now. Wow, older than me, honey child. But it's a great opportunity for you to reconnect with, just the culture, celebrating our land, our culture, and our community through agriculture. And the kids love it. They love go and see all of the animals. I know my daughter loves to see the animals. We went to an event yesterday. We're on vacation, so we like to do events, not just shopping. You got to balance it out because kids are like, oh, you going away, let's go shopping. I'm like, no, we're going to go to concerts, we're going to do fairs and carnivals and different types of events. So we were somewhere yesterday and they had some goats on display, 2 little goats, and she's like, oh mom, they have goats, can I go pet the goat? I was like, I said, stand up there and I'll take a picture of you and the goat. Then she's like, oh, they stink. I'm like, yeah, that's the thing with agriculture. They got to use the bathroom. She's like, mom, they stink. And I said, yep. I said, don't mention it to your dad though, because if we tell him we saw goats, he'll be asking about some good curry goat. Were they curried? What kind of goat? All right. Strong Will says he still sounds good. Okay. Anthony says we're just up his last retirement plan funding. Poor Ting. Aw. Marshall says, yes, poor man. He's had his time on stage. Good music, but he just needs to relax now. We're going to get there one day. God bless him. Strong will. If we're lucky, we're going to get there one day. Marcia says, once there is life, there's hope. He loves what he's doing. Okay. Oh, Miss Barbara says, that's what I meant, for them to embarrass him. Sorry. Yeah. I think it's up to the family to make certain decision about when someone can continue to perform or not. Even if he loves it, like have him perform at home for the family, grandkids and stuff like that. You know, you can't. Yeah, I mean, if you really love, that's like saying that someone loves being a doctor, but they no longer should be operating on patients. You can't be like, oh, just let them operate on them because they love it. What's the harm? Okay. Live Happy says her true Jamaican accent was effortless. It must be stressing to having to fake a Caymanian accent all the time. Oh, Zosha? Does she talk with a Caymanian accent? Aw, poor ting. There's no need to do that, though. I mean, Caymanians are very accepting of Jamaicans as they are. So why are you trying to talk with a Caymanian accent? You're Jamaican. Be proud and loud, honey child. Even in the radio, make it come through. People don't have to fake their accents. You know, I always feel a way about this. For example, when I see, let me think who else does this on radio locally. No, man, I think you gotta, you know, it's one thing to try to articulate because obviously you have an audience, so you have to be mindful of who your audience is. So your audience could really be from all over the world. That's fine. But that doesn't mean that you have to give up your natural accent. Like, if you know me, if you really know me, I don't speak any differently, although I do know that as human beings, depending on who we're around, sometimes an accent can get thicker, for sure. And it can become more pronounced, right? But this is how I talk, like, you know, and I don't make any apologies for it because, yes, I lived in the States for over 50 years. So there are times when I'm aware that I sound very American. I have a very American twang, and I accept that. And there are times when I sound less Caymanian because I was there till 9, then I left for 15 years, and then I came back. But, you know, if I'm around certain people, I'll admit that it becomes probably a bit more pronounced. You know, the funny thing is, talking about accents, right? Marlon is like that as well. Because he doesn't really, if you talk to Marlon, a lot of times you have no clue that he's a Yardie. Like, you have to be like, you know, but if he's speaking to another Jamaican, then you hear it a bit more pronounced. But sometimes Jamaicans have no clue where he's from. Like, they meet him and he's talking to them and they're like, where are you from? and he's like, really? And it's so funny because a lot of times they guess everywhere but Jamaica. Are you from India? Nope. Guyana? No. Oh, you must be Trinidad, because they kind of hear some hint of a Caribbeanness there. Okay, you a Trinidad? No. Then they're like, They start trying to narrow it down, you know? And he's just like, really? I'm from Jamaica. They're like, what? What part of Jamaica are you from? Yardie? Indian? Or Jamaicans call all Indians Indian. If you know, you know. Every Indian in Jamaica, their nickname is going to be Indian. Yeah. So I'm just adjusting my little headset thing here. I noticed this front port is not as good as the other port. All right. All right. Irvelyn, good morning to Robert. How you doing, honey child? Palmer Cornwell says, I'm pretty sure I saw old people in concerts. I saw old people in concerts, shaking my head. It's not about someone being old. Let's be very, very clear here. It's about their ability to perform. So yes, you see older people still performing well into their years. But it's really about their health. And if that is actually in the best interest of the individual, right? So no disrespect to, like I said, the legendary Freddie McGregor, none whatsoever. But does he look like he's in the best health, irrespective of his age? I've known people in their 80s and 90s performing, and they sound and look better than him. So it's just Anthony brought it up yesterday. We didn't touch it yesterday. But to be fair to Anthony, I do agree that he does not look like he is in the best of conditions to be performing. You know, and it's not about old people. It's not about old people no longer can do this and that. No, it's about you look at the individual and you make an assessment if they still have what it takes. And I would say performing on a stage is probably one of the more challenging things to do in the entertainment business. People have all kind of expectations of you, honey child, whether you're young, middle age, whatever. And I personally give props to anybody who can do that, because it's not easy. It is not easy. That's why Benito, aka Bad Bunny, honey child, when I saw him performing, doing his thing, and I didn't understand really a word he said except selfie. And what other words did I catch? Did he say something about his abuela or something? I don't know. But he also used Spanish terms that are specific to Puerto Rico that are a little bit colloquial. But I did hear selfie, and I heard some other words that I caught here and there. So I don't know what, but I didn't know until afterwards. I saw some interpretations of some translations rather of what he's saying. But his performance outside of that, his performance was hype, right? Bad Bunny brought the bad in the bunny. Oh, listen, can y'all hear Mother Nature? Hear that little bird doing my squawking. So beautiful. Hi. Hello, puppy. Hello. How are you? Good morning. Good morning. Hi, Georgia. Hi, Georgia. How are you? You want everybody to see you on the camera? Come, will she let me pick her up? Yeah. She's not as light as Zoo. Hi, Georgia. Say hi, Cayman Islands. Say hi, everybody. This is Georgia. Isn't she gorgeous? She's very high energy. Yeah, when she says good morning, she gets a proper good morning. Beautiful brown eyes. Such a pretty girl. All right. All right. So, yes, no disrespect intended. Strong Will says, Anthony, be careful. I hope you don't get a stroke one day. That's my 2 cents. Oh, no. Strong Will, I think that y'all are really getting Anthony's position wrong. I don't think Anthony's trying to be mean or anything like that. We could all be victims of the things that life will throw at us. As we can see here from that Health City segment, child, most of us can probably end up having defib and all this other stuff. These things will happen. We're going to have strokes. We're going to have heart attacks. We're going to have, it's just all he's saying is, I think his only point really was, why is government sponsoring it? First of all, maybe it should be a private concert, and that government has a responsibility when they sponsor certain things and when they do things to ensure that they're getting value for money. Right. And so, yeah, I think that's a fair, I don't think Anthony was trying to be mean to Mr. McGregor or his family or anything like that. Inspiring says, no es bueno, no es bueno. We never know how we'll end up in life, and not because we're old, we're going to stop doing the things we love. Let me tell y'all something, okay? Let me make it very, very clear. If I get to the position, and heaven forbid, but one never knows in life, where I am too old to do this show, and I can't be honest with myself, y'all need to tell me, because I'm going to be here a long time, God's willing, trying to do the right things that we all need to do. I'm going to start lifting some deadlifts here, some weights and stuff, okay? But if I get to the point where I've had a stroke and I can't speak properly and you guys don't know what I'm saying, y'all just need to tell me, Auntie Sandy, please go sit in your rocking chair on your porch somewhere and hang up the mic. There will be no more microphones in your life. That's okay. That's okay. That's all right. Gabby says the Sanchez show they had in 2024 was so good. That man is aging. So happy I got to see him live. Who is Sanchez? Sanchez who? I'll tell you, I don't keep up with these things. I gotta be honest with you. Mellow Fellow says, yes, he had a stroke 2022. His sons are well-known, accomplished entertainers. They are? Okay. Chino is a Grammy Award winning performer and songwriter. Steven is a globally known producer. All right. But do you think that they could have put on that show and had people go without using Freddie McGregor's name? Because if that is the case, if they're known within their own rights, then that even supports what Anthony and I are saying more. Like, why? Why are you allowing him to headline it? Like, make the Suns do it. Yandy has a child with his son Chino. She's not with him anymore. She's now married to somebody else. Okay. Y'all be up in these people's business. I don't know Yandy, I know who she is, but okay. Doesn't she have a couple children? All right. According to Trusty AI, his only performance, says Anthony, since 2020 was February the 7th, 2026. Where was that one? Because that was before. Miss Sue says, I love Freddie McGregor always, but sorry, I don't think he had the stroke last year. I saw him last year. It's so sad, really, but no, he's not the same now. Okay. Marshall says you're not in Cayman, so no holiday for you. That's funny. The show must go on here in the U.S. By the way, yesterday was a holiday in the U.S. It was President's Day, and I did the show. So I'm still, yes, I'm still in Cayman time though, Cayman scheduling. Okay, but what if you want to buy plants? Will the bus take them to your car or to my house because I live close by? All right, let me ask the question. You see, normally the traffic starts to happen. You got the early risers who go to the agriculture show really, really early in the morning. So it's probably meant for people like as the day gets busier and as the people start to go out. But let me ask, let me just touch base this one quick second here and see what we got. All right. Let me just ask the questions. Una pregunta, por favor. Okay. And let me tell you something. Can I give y'all some sus? The Bad Bunny, I think everybody now, have you guys seen all the meme videos of people at work are like, oh yeah, they're showing up to work now doing the Bad Bunny like swag and singing the song and whatever. It's so funny. But you know, everybody now wants to, apparently they track what happens like after concerts, and Bad Bunny, he's now doing concerts all over, and his, you know, trajectory has really gone up. And now everybody's Googling more how to, like, Spanish lessons. Everybody wants to take Spanish and learn how to speak Espanol because of Bad Bunny. I was like, go on there. Go on through Bad Bunny. He's done more for the Spanish-speaking community than anybody else. Auntie, where are you? Listening to birds behind you. You sound so relaxing. I love me a bird. Oh, yes. I'm on vacation. That's why if you want to call me this week, you can only call through the show, 936-2636. So through WhatsApp, I should say, on the show this morning. But yes, where I am, there's a beautiful river. I don't know if you guys can see it, but there's like a beautiful lake back here. Everything, because of the cold, everything is, you can't really see it that well. Tomorrow, not tomorrow, because I'm not doing a show tomorrow if it's holiday. The day after, I might have another camera angle so that you guys can see. In fact, let me see. Let me just have a quick look. It is beautiful here. It is gorgeous. All right, let me see. How do I bring in my phone into the stream? Hold on one second. I think I'm gonna try it. Oh yeah, we're gonna try a little something here. All right, let me see. I can join my own show with the link. So hold on. Let me try it. So yeah, big Big shout out to, let me see here. Big shout out to, okay, let me see, 1 second. Yesterday. All right. Okay, let me turn down the volume on the phone, I think, because otherwise I'm going to get this little feedback thing. Entering the studio, once you use your camera, allow, but I'm going to reverse my camera so you guys can see the back camera. Back camera. Yes. Okay. Okay. And then audio, we're actually going to, I'm going to mute that once I get in, because otherwise you guys will hear the feedback. I'm just going to show you a little bit of the setting that I'm in. Not too much. Let's mute my audio in there. Okay. Gotta turn that audio down. All right. So now I'm going to show you guys. Hold on. Let me see. Okay. I guess I have to do it this way. Let's see. It's beautiful. Beautiful scenery, outdoors. There's a body of water right over there. There is the little pit area over there where you could do some marshmallows. And yeah, so there's lots of things, trees and stuff. All the trees are burnt though from the cold snap. Look, all the trees. Yep. Not a leaf on them really, because they're not cold weather trees. So they get all burnt up. There's the pool over there. We will not be getting in the pool. It's too cold for that. But yeah, it's beautiful. It's an absolutely gorgeous, gorgeous environment. And I'm going to get out today and enjoy some of it. So that's me on vacation. I'll tell you all about it later. When I come back from vacation, that's when I like to talk about my vacations. All right. So your ring is big and blinging. Evelyn, it's the same one always. Although I kind of, maybe because it's my laptop camera, so maybe it kind of looks bigger than usual. But yeah, hubby did an upgrade for me a couple years back, you know. So I think when we get to 20 years, I'm going to need another upgrade. What? Is it entrance plus the cost of the ticket for the agriculture show? No, it's just the $10 for kids. Okay, hold on. Let me go back to the pricing. Oh, $10 is adults, $5 for kids. Yeah, that's all you pay. 2 and under is free. Seniors over 65 are free. If you want to do the raffle tickets, then those are separate. But the raffle tickets include the entry. I think that's what you're asking, right? So if you buy those are $25, but they get you entered into the raffle. So that, as my memory serves me correctly, those include the entry and the raffle. Yeah. All right, Jackie, good morning, honey child. How you doing? Sue says exactly right. Anthony's right to say I was not going till I found this out about Freddie, but he looked okay. El Ray says, but Willie Nelson looks twice as old as Freddie McGregor, and he's still performing on stage. It's not about looks. I think El Ray, again, I haven't seen Willie Nelson, but when you say he looks twice as old, let me see if I can look him up. Let me see what Willie Nelson, what's his name? Willie Nelson? So it's not about how he looks per se, in terms of, yeah, he might, you know, because let's be honest, our Caucasian friends, they do, you know, age a little bit different, but can he actually still sing on stage? Can he still perform on stage? I mean, poor Freddie McGregor, 4 minutes to midnight, he's coming on. He probably should have been in bed sleeping. Y'all need to leave that man alone. Let me see. He's, and by the way, Willie, what is his name? Willie Nelson. He is at least in his 90s, I believe. And not everybody ages the same. So hold on 1 second. By comparison, I want to see a year ago, Whiskey River What is this one? Whiskey River. Okay, so this is him performing. So give me 1 second here. Because, I mean, this is a good question. Give me 1 second here. Let me download this. What's it called again? Okay. Yeah. Okay, give me 1 second. I do want to see, because I'm not going Willie Nelson concerts either. But the difference probably, Al Ray, is I'm willing to bet you that the government in the US is not, not for nothing, but they're not the ones actually, and this goes back to Anthony's point, they're not the ones who are putting on the Willie. They're not sponsoring it. So I doubt anybody cares if it's privately sponsored. Okay, so 1 second. I got a Willie Nelson performance video here. Let me unmute it. Yeah, he looks old. I mean, when you're 90s, what do you expect? But I tell you what, you ain't messing with Willie Nelson. Hello, that man is on this guitar, ping-a-ling-a-linging, like he is. Whoa, I'm just like impressed. Hold on. So I mean, this is where it matters. You know what I'm saying? So let's have a look at Willie Nelson. Willie Nelson sitting there stringing a guitar. That man is playing. He still remember chords, and yeah, he looks old. But that ain't the point, El Ray. You're missing it. Let's listen to the music now. Hold on, let me unmute him. Hold on, Willie. Ooh, look at that! Look at the work on the. Look at them fingers still working. What? Mess with him. I'm gonna give that one a like. And he ain't got no backup singers. He got live band members, but he's still singing. And what? Look at that. Wow, I'm impressed by the finger work. I ain't gonna lie. That looked pretty impressive. So, I mean, he's still, he's playing a guitar and he's singing. That is not someone whose faculties I'm concerned about, despite the fact that he's 90 something. So, it's not about being old. I think it's about your ability to perform in a way that an audience would mostly be like, if you have 80% of the audience going, no, Bobo, that's not it. Maybe it's time that you listen. Good morning, Miss Lucille, my princess. Oh, you're sick today? Oh, your princess is sick. Take her to the vet. Oh, is that your little cat? Oh, I'm so sorry to hear that. Hopefully she's okay. All right, well, you can pick and choose. I mean, those of you who are sitting here saying, yeah, make him keep singing. Did you go to the concert? Did you support? That's my question. Did government, get some money back from supporting it? That's what I want to know. At least was it a commercially viable venue or experience because you guys went and supported it? Abby says, I just want some seasoned peppers. Oh, some seasoned pepper plants or just the seasoned peppers? Get yourself some plants, honey child. Lady D says, Spanish is getting there, Sandy. Practice and more practice. Soon a Spanish segment. Well, the truth of the matter is my Spanish has been good for a long time, and it used to be better back in the day because I actually remembered more words, so I was more fluent. In fact, when I went to university at USF, I did like the test, you have to do your test to see, where they're going to place you because you had a mandatory foreign language requirement. And I was put in level 3 at the university stage because that's how good my Spanish was back in the day. But No practicar, you know, you lose it, honey child. So I've always kind of felt like if I go and do an immersion program for I'm gonna say some of this in Spanish. 6 meses en por ejemplo Costa Rica or no Cuba, Nicaragua, maybe even Honduras, right? If I did 6 months, 6 meses, I could be very, very fluent because I have the foundation. I have a lot of the pronunciation and stuff like that. It's just like learning more vocabulary. And what trips me up is a lot of like the conjugation. But I can read a lot. That's why I did so well in my test. Is, you know, I can read and understand a lot of Spanish. But when it comes to hearing it, a lot of times I need to tell people, okay, hable despacio, por favor, because, you know, you got to slow it down. And then I got to think about it. So the brain firing, like that's a little bit different. But yeah, I would love to be fluent. I got to start practicing with some of my Spanish friends. All right. Nope. AJ, trying to guess where I am. I'm not there. Auntie, you take too much vacation. I'm vexed. But this is a working vacation. Estoy trabajando. Come on. It's not exactly like, you know, Anthony's guessing Orlando or Tallahassee. You know, I've never vacationed in Tallahassee. What is there to see in Tallahassee? I think I've only been to Tallahassee like once or twice when I was in university. We did some student advocacy stuff with the student government. And so we did some trips then. But yeah, other than it being the state capital, I don't know what else is there. Good morning, Sue. She says he's great old. He's great old, but good. Miss Sue says he loves his weed. Bless his little heart. But he has enough money. He should retire also. Like I said, I mean, listen, sometimes it isn't about the money, Strong Willed. I'm not saying, and I don't know what his financial position is. How do you know he has enough money? Just because you've made a lot of money in your life doesn't mean at retirement that you have enough. Because, you know, it's rough out in these streets when you got to retire. So I don't know. But Lady D says, yes, practice is the key. Yeah. And, you know, they have a thing now that I saw the other day where they have you watch stuff in Spanish and then you like reading the words and you see how stuff is put together. There's different ways of like learning it. But I think just practicing with a native speaker where you're hearing them, you're talking to them, you're interacting with them is the best thing, really. But I can hold a basic conversation. You know, somebody can ask me how I'm doing and we can probably talk about the weather a little bit, you know, like I know a little bit of that. And yeah. So, let me just see here. What else we got, honey child? So no show tomorrow because it is Ash Wednesday. Please enjoy your Ash Wednesday. And let me remind you that on Saturday is the 9th annual Youth Mental Health Symposium, the Alex Panton Foundation, but it's officially at capacity. Isn't that amazing? Isn't that amazing? Somebody gave me an amen and hallelujah up in here. I don't have my amen buttons program, but due to overwhelming support from the community, registration for the event has been closed. So they want to thank everyone who registered and continues to show up for youth mental health in the Cayman Islands. This year's theme, Lighting the Way, Turning Hope into Action, is going to bring together expert speakers for a full day of meaningful conversation and practical insight. You can view, if you've already registered, please go online and you can view the full agenda and speaker lineup at alexpantonfoundation.com. I think that is amazing. Amazing. They've had to close registration from last week, actually, for the event because they've had such an amazing response. So please, if you have registered, make sure you show up. Do not waste that opportunity, right? Because somebody else could have gotten that seat. So make sure, honey child, you show up, because yes, Irvlyn, I absolutely love that. I registered, so I will be there on Saturday, and I will bring you guys some sauce about it on Monday. Hopefully we'll have some snippets from like some of the guest speakers and different stuff, because yeah, it is an amazing symposium. 9th annual. I'm excited for the 10th annual next year as well. All right. So if you registered, I will see you there. Okay. I am done sitting outside in the, it's warming up, but it's still a little bit cool weather. I am going to go and hit the shops. I think we're going to do a little bit of spa stuff today. Miss Gigi wants to get her pedicure done, so we might get some time to do that today as well. And yeah, I'm out of here. So you guys have a beautiful day. Yeah, let me know your feedback on, should we do more shows on the outdoors, even when we're in Cayman? We got a little gazebo space outside that we could be utilizing. I love being outside. Maybe that's how I can get some sun for my vitamin D levels. Sit in the sun as I do the show. But yes, let me know what thoughts are, and we can make it happen. All right, please enjoy the agriculture show tomorrow. I'm relying on you guys. I do have some media coverage there, but I'm relying on you guys to also send me tidbits of what you got going on at the agriculture show. Send me your snapshots, your pictures, do your little videos, all that fun stuff, so that you can keep me on the loop on what is happening back home. But y'all know I'll be getting the sauce. Have a beautiful day, Cayman. Love you guys so much. Lady D says, yes, more nature. I'm here for it. I am absolutely here for it. Have a safe day, and please be safe tomorrow. Let me know how the new roundabout, if it helps, but take the bus, take the ride and share to the agriculture show if you can. But do let me know how that new roundabout is going. And yeah, that's it. Have a good day, guys. Bye for now. Toodaloo.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.